Welcome back. This is Sunday Express. Now, doctors are sounding the alarm over the rising number of childhood cancer cases in the country. Now, each year, at least 3,000 children and adolescents are diagnosed with cancer. A growing concern that underscores the urgent need for increased awareness and early detection. So tonight, our health reporter Marie Yambo sat down with pediatric oncologist Dr. Banis Mukuria at the Kenyatta National Hospital to understand the scale of the issue and what can be done. Over to you, Marie.
Thank you so much, Regina. We're coming to you from the Kenyatta National Hospital Children Oncology Ward, and today we're talking about childhood cancer, September being the Childhood Cancer Awareness Month. And to break it down to us is none other than Dr. Banis Mukuria. She is a pediatric oncologist. Thank you so much, Dr. Mukuria, for joining us.
So thank you for coming all the way here to make noise about Childhood Cancer Awareness Month.
First things first, 3,000 children, are diagnosed with cancer, childhood cancer, particularly annually in Kenya. Are we seeing an increase in childhood cancer, and if so, why?
Like you said, every year in September, we mark Childhood Cancer Awareness Month globally because we all need to make the noise that needs to be made to make people aware that children actually do get cancer. So you're correct in stating the figures as being 3,000 new cancer diagnoses in the country. These are actually conservative figures given by the Ministry of Health. And you're also correct in saying that they have increased over the last few years. About 5-10 years ago, we were recording about 2,000, maybe 2,500 new cases. But now with increase in capacity for childhood cancer, not just doctors and nurses, but also awareness in the community through such initiatives as, interviews and even just going to community outreach programs, we've been able to sort of increase the awareness about childhood cancer. And now we're seeing about 3,000, 2,500 new cases every year in our country. We still say this is a bit of a conservative figure because we know that childhood cancer is one of those things that is not easy to diagnose. One, there has to be awareness. Do people know what to look out for out there mashinani? Second, we have to have the diagnostic capability. And from there, we also now have to start treating. So in as much as we're seeing an increasing number, even if it's over time, it's still a conservative figure because we still have lots to do in terms of making the actual diagnosis across the country.
So when we talk about childhood cancer, we particularly mean cancer that affects children. Does it mean that there are certain ages where certain cancers are more prevalent in children?
Childhood cancer is cancer occurring in any individual aged between 0 and 19 years old. In Kenyatta National Hospital, we actually see children in our wards from the age of 0 up to 13. And the older ones, the older teenagers and adolescents are treated in a different ward, though sometimes we do house them in the pediatric unit. Yes, so that's what it is. That's just cancer occurring in a child who's in an individual aged 0 to 19 years of age.
Probably you could just talk to us, name for us some of these cancers, and even as you do that, what are their signs and symptoms?
Okay. All right, so thank you for that as well. So yes, we do have cancers that do occur more commonly in the in childhood as opposed to adulthood, right? So there are cancers that are very common in children below the age of 5. So 0 to 5, we'll see certain cancers. In the older child, up to 10 years, we'll see certain cancers as well. And there are also other cancers that occur more commonly in the teenage to adults and to adolescents and young adults. So in terms of what we see most commonly, worldwide, actually it's more of acute leukemias, and the same picture is demonstrated also in Kenyatta National Hospital, where most of our diagnoses are that of acute leukemia. Yeah, so you have two main types of acute leukemia, but they're the most common diagnosis that's seen among children. Other cases that we see include brain tumors. We don't see them as frequently as we expect based on statistics seen globally, and this is because we have various specialties, and sometimes they're seen in different parts of the hospital. They might pass by the neurosurgery unit first and then get lost to follow up, or they may pass by a different surgical unit and be seen there, and then we see them a bit later in their diagnosis. Then in the preschool age group, we see a lot of abdominal tumors, such as kidney tumors, most commonly one we call Wilms tumor. It's very common in the preschool age group. That's between the age of 2 and 5 years old. Why it's important is that, one, it's a curable cancer. Yeah, so we really want the awareness to be there in the community so that we're able to pick it up and direct treatment to these children earlier, sooner rather than later. In terms of other cancers we see in the older age groups, things like bone tumors tend to occur more commonly in children who are experiencing a rapid growth spurt, for example. So you will see bone tumors, especially in the long bones of the lower limbs. They may also occur in the upper limbs or any other parts, any other bony bone in the human body. Yeah, so that's basically it. We also see cancers of other parts of the body. So lymph nodes, you'll see lymphomas. Muscle, we'll see tumors that affect muscle primarily, and they're also very common in children. We call them sarcomas, and any other soft tissue in the body. So really, cancer can occur in any part of the body. What we need is a high index of suspicion, especially at the first contact with these patients. Unfortunately, there are no specific signs and symptoms that can be attributed specifically to the cancer. They're very common signs and symptoms that we see in any other more commonly occurring infections that we see more commonly in our country. For example, tuberculosis, for example, will present with fevers, weight loss, night sweats, and stuff like that. And you find that these cancers affecting the blood and even the lymphatic or lymph nodes can present with similar signs and symptoms. Something that can help raise your suspicion for acute leukemia in a child would be the occurrence of bone pain, especially in the long bones. You find that a child is even unable to walk, and it's very unusual for a child not to be playing. So such signs and symptoms should actually raise your index of suspicion as a parent and even as a healthcare worker, wherever you encounter these children, to sort of look for these illnesses and probably catch them early so we can treat them early.
In adults, we talk about risk factors, and this could be alcohol, too much intake of alcohol, smoking, or just sedentary lifestyle and so forth. What are the risk factors for childhood cancer?
More than 95% of cases of childhood cancer have no known attributable cause. They just occur spontaneously. And that's why it's difficult to insist on maybe screening like how we do for breast cancer or cervical cancer in adult women. Yeah, there really is not much screening that we can do for childhood cancer, except maybe for one particular cancer, which is one that affects the eye. We call it retinoblastoma. It's very easy to pick it up. There'll just be an abnormal whitish sort of spot in the eye. This can be picked up at any point where you encounter this child, be it at the Well Baby Clinic, for example. All you have to do as a healthcare worker is just shine a torch, shine a light and see any abnormal occurring sort of whitish discoloration. That can point towards a malignancy in the eye or a cancer in the eye. And this should not trigger you as a parent or even as a healthcare worker to push them towards a center where we're able to provide comprehensive care for a child with cancer. So push for diagnosis and early initiation of treatment. Yes, but in terms of screening generally for childhood cancers, there's not much we can do, as majority occurs spontaneously. However, there is about 5% of cancers in children that are as a result of genetically acquired predisposition. So there are certain syndromes that can predispose a child to developing cancer, be it a cancer affecting the blood or any other organ of the body.
Yeah. Now, when it comes to treatment of, cancers in children, for that matter, in low-income countries, we are seeing just about 30% success, vis-a-vis 80% success in higher-income countries. Explain that.
Yeah, thanks for that question. Again, it's pertinent because it's a huge disparity that we are facing as healthcare workers working in low to middle income countries. Like you've correctly stated, so every year, annually, we diagnose about 400,000 new cases of childhood cancer in the world. 90% of this burden lies in sub-Saharan Africa, which includes Kenya, right? Where we're seeing only about 3,000 to 4,000 new cases in a year, right? So 90% are diagnosed in sub-Saharan Africa, but of these, only about 10 to 20% will have the outcomes that we hope for, which is complete survival beyond 5 years post-treatment, right? Yeah, so the disparities are many. This is inverse for high-income countries. So they get about 10% of the burden, but they get about 90% cure rates. And there are many reasons for this. One, which I alluded to earlier, has to do with the lack of diagnostic capability, or even just recognizing that this could possibly be a childhood cancer. And this is why we say we need to put in more effort towards early awareness, early warning signs and symptoms for possible childhood cancer, in our setting. So this means educating the healthcare worker at the primary healthcare facility that the patient will likely present to. Yeah, at their first encounter with the healthcare system, should have somebody who has a high index of suspicion for possibility of childhood cancer being a possibility for the child that they're seeing. One, so that's education and creating awareness. Two, access. In Kenya, we have 3 main public hospitals that provide comprehensive cancer care for children. That's Kenyatta National Hospital, where we are right now, Kenyatta University Teaching Research and Referral Hospital, again in Nairobi, and Moi Teaching and Research or Referral Hospital in Eldoret. So that's only 3, serving a population of millions of children. So in terms of capacity, we still have some ways to go, right? In terms of personnel for health, we don't have enough trained oncologists. We do have pediatricians, at least in every county of the country, and that really helps in management of our children, because pediatricians are also trained in oncology through their rotation. So it helps having somebody who will more likely have a high index of suspicion and thus refer, or help the team, wherever they are, follow the proper referral pattern to get these children to us here or in any of the other centers that are taking care of these children. So there's that. Other things also have to do with cost. Cost of cancer care is really expensive. One, you have to think about the transport. Like we said, there are only 3 centers. We do have patients here who are from places as far as Turkana, Garissa, Wajir, Mombasa, right? We need to bring the care closer to every Kenyan, essentially.
And even talking about treatment and outcomes for children in childhood cancers, there's also the, can I say it's a notion, but probably it's not a notion, that children tend to, respond better than adults. Why is that so? There's also the issue of concept. Yeah. They don't have a concept of death. Yeah. And like an adult, for instance, if you told me I have cancer today, I'll be thinking of the way I'm already buried and all that. So, but why is that children actually respond better?
Right. So in terms of outcomes for cancer treatment, you're right in saying that children tend to do a bit better than adults do. There are way higher rates of mortality in the adult population compared to the childhood population. And there are various reasons that have been proposed as possible reasons why this is the case. One of them being the differences in physiology and in the sort of changes that have to happen in the child's body for cancer to actually happen and develop. Yeah, so there tend to be more sophisticated changes in adults, to put it as lightly as possible, that can make treatment a bit more difficult for them. But there's also the stigma associated with the diagnosis of cancer. So unfortunately, there's a lot of stigma associated with a cancer diagnosis, and most times people start thinking of it as the end. However, for children, we come in with a lot of hope, because we know that we can actually treat these patients and bring them to cure, right? So we tend to work very closely with our pediatric palliative care team, another specialty team that's available here in the Kenyatta National Hospital. And they really help us walk the journey of treatment, diagnosis, treatment, and survivorship with these children. They play a huge role even in disclosure of the child's disease condition in an age-appropriate way, which helps them also to take part in their own treatment. And this goes a long way in helping us achieve the outcome that we so desire, because having the family taking part in the treatment journey is winning the first part of the battle. Really.
How important is it then for parents, maybe, or guardians listening to you, caregivers, to maintain a routine for the children? Here you are, a child who is immunosuppressed and very many other challenges. But why is it important to keep the routine for that child? Yeah.
I would say it's really important to try and keep as normal as possible a routine as possible for this child, right? And for the family as a whole. Most times you'll find it's not an only child, for example, there are other children as well. One, as a parent, you don't want to now neglect your other children and focus on one. Although sometimes you might be forced by circumstances to really focus a lot of your energy on the one who's not doing very well clinically. The other thing is, in terms of keeping things normal, fine, we do understand that cancer in and of itself is a disease that will cause suppression of the immune system in these children. But another thing is that even the treatment of cancers will cause some level of suppression of the child's immune system. So yes, we do encourage when they're at home to go and play and interact with other people. However, it has to be within limits, wear a mask, hand washing, limit the numbers of people interacting with, but try and keep as normal a routine as possible.
Thank you so much, Dr. Bernice, for breaking down to us what childhood cancer is all about. And September is Childhood Cancer Awareness Month. Mm-hmm. And so what will be your message?
All right, thank you. Thank you very much, first of all, for having us here and highlighting that we do take care of children with cancer, but also for giving us this opportunity to make noise for these children. So yes, September annually is celebrated as Childhood Cancer Awareness Month. we basically use this month to create awareness on the existence of childhood cancer. Unfortunately, there's this huge misconception that cancer does not occur in children. We had to tell people that cancer can happen in children, but more than that, cancer is treatable and curable in children. And there's access to these treatments in Kenya, right? So in Kenyatta National Hospital, Kenyatta University Teaching, Research and Referral Hospital, Moi Teaching and Referral Hospital, and also some private centers are providing comprehensive childhood cancer care. So it does occur in children and it is treatable. Yeah, so do not be afraid of a diagnosis of childhood cancer in your child or in a child that you know.
Yeah. Okay. Thank you so much, Daktari, for breaking it down to us.
Thank you.
September is the Childhood Cancer Awareness Month, and we've been talking to Dr. Bernice Mukuria. She's a pediatric oncologist, breaking down some of the types of childhood cancers, from leukemia, and the symptoms, treatment, and how important it is for families to keep just a normal routine for children, and also issues of early diagnosis being a very big issue. So thank you so much for making the time for us, Regina. It's back to you in the studio.